Hi, I'm Garvin. Welcome to our new telehealth service. In this video, I will give a brief overview of what you need to know about an enlarged prostate. In particular, I will cover what it is, how do you treat an enlarged prostate, and how can you better live with an enlarged prostate. So we start with what is an enlarged prostate. The prostate gland and an enlarged prostate gland is a common condition as men get older. It's also called benign prostatic hyperplasia, or BPH for short, and prostatic hypertrophy. The prostate gland enlargement can cause bothersome urinary symptoms. Untreated, prostate gland enlargement can block the flow of urine out of the bladder and can cause bladder, urinary tract, or kidney problems. There are several effective treatments for prostate gland enlargement. In deciding the best option for you, you and your doctor will consider your particular symptoms, the size of your prostate, and other health problems you may have. Treatments for prostate gland enlargement include medications, lifestyle changes, and surgery. Prostate gland enlargement varies in severity among men and tends to gradually worsen over time. So prostate gland enlargement symptoms include weak urine stream and difficulty starting urination, stopping and starting while urinating, dribbling at the end of urination, frequent or urgent need to urinate, increased frequency of urination at night, straining while urinating, and not being able to completely empty the bladder, blood in the urine and urinary tract infections, formation of stones in the bladder, and impaired kidney function. So having a more enlarged prostate doesn't necessarily mean your symptoms will be worse. Some men with only slightly enlarged prostates have significant symptoms. The prostate gland is the male organ that produces most of the fluid in semen. The milky curdled fluid that nourishes and transports sperm out of the penis during ejaculation. It sits beneath your bladder. The tube that transports urine from the bladder and out your penis passes through the center of the prostate. Basically, your urethra passes through the prostate as if it were passing through a donut hole. When the prostate enlarges, the hole shrinks and begins to block urine flow. Most men have continued prostate growth throughout life. In many men, this continued growth enlarges the prostate enough to cause urinary symptoms or to significantly block urine flow. Doctors aren't sure exactly what causes the prostate to enlarge. It may be due to changes in the balance of sex hormones as men get older. The main risk factors for prostate gland enlargement include aging. About half the men in their 60s have some signs and symptoms. Next would be family history. Having a blood relative, such as a father or a brother, with prostate problems means you're more likely to have problems as well. Next would be ethnic background. Prostate enlargement is more common in white and black men. And prostate gland enlargement becomes a serious problem when it severely interferes with your ability to empty your bladder. So next is, how do you treat an enlarged prostate? There's a wide variety of treatments that are available for enlarged prostate. They include medications and surgery. The best treatment choice for you depends on several factors, including how much your symptoms bother you, the size of your prostate, and any other health conditions you may have. So first, medications. The medications used to relieve symptoms of enlarged prostate include, so the first, it's alpha blockers. These medications relax bladder neck muscles and muscle fibers in the prostate itself and make it easier to urinate. These medications include Hytrin, Cardura, and Omnic. They're the brand names. Alpha blockers work quickly. Within a day or two, you'll probably have increased urinary flow and need to urinate less often. Next, it's the 5-alpha reductase inhibitors. These medications shrink your prostate by preventing hormonal changes that cause prostate growth. They include Proscar and Avodart. They generally work best for very enlarged prostates. It may be several weeks or even months before you notice improvement. Also, we have combination drug therapy. Taking an alpha blocker and a 5-alpha reductase inhibitor at the same time is generally more effective than taking just one or the other by itself. And finally, we have surgery. Your doctor may recommend surgery if medication isn't effective or if you have severe symptoms. There are several types of surgery for an enlarged prostate. They all reduce the size of the prostate gland and open the urethra by treating the enlarged prostate tissue that blocks the flow of urine. The decision about which type of surgery may be an option is based on a number of factors. So that brings us to how do you live with an enlarged prostate. Making some lifestyle changes can often help control the symptoms of an enlarged prostate and prevent your condition from worsening. So you could try these measures. Limit beverages in the evening. Don't drink too much caffeine or alcohol. If you take water tablets like diuretic, talk to your doctor and they might recommend something else. Limit decongestants or antihistamines and go to the toilet when you feel the urge. And even if it comes with you, schedule bathroom visits and try and stay as active as possible and urinate and then urinate again a few moments later. And finally, keep warm. So staying warm is very important. And finally, before I finish, there are numerous products available at Lynch's Pharmacy here in Douglas and Cork to assist you in managing an enlarged prostate more effectively. Pharmacy products to start with, we have numerous products available to get you started on an exercise regime. So like exercise balls, floor mats, weights, and various equipment required for light exercise, and pedometers, skipping ropes, body fat monitors, and calorie counters and diaries. We also have various supplements which you can purchase from us without prescription. So some like saw palmetto, beta-citterol, ryegrass extract, and stinging nettle. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new service, a telehealth clinic. You can book a 30-minute clinic at our pharmacy in order to increase your understanding of your illness. During this clinic, we create a cohesive management plan which enables you to take a more active role in managing an enlarged prostate with confidence. So call into us at Lynch's Pharmacy in Douglas and Cork or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.